topic of my presentation was the genetic risk factors or predictors and predictors of intracerebral hemorrhage and predictors of outcome and severity at the same time. And I think that this is an emerging topic because you know that the genetic studies really shifted the paradigm in terms of discovering the newer and newer risk factors, I mean the genetic risk factors. And everything was started by so-called candidate gene association studies, and nowadays the huge genome-wide association studies, which allow to examine almost whole genome, led us to discover many susceptibility loci in different chromosomes, which contribute to development of intracerebral hemorrhage. And this is really an emerging topic which should be interesting for not only for the specialists working in the genetics of neurological diseases, but also for the wider audience of neurologists working in general with stroke. For decades, we knew about familiar cases of intracerebral hemorrhages, which was mostly linked to so-called Mendelian or monogenic genetic inheritance. We knew about familiar cerebral amyloid angiopathy-related ICHs. We also knew about some other families with different genes which were contributing to intracerebral hemorrhage, like collagen for A1 gene. These diseases were caused by so-called rare mutations with very high penetrance and very high risk. And but these diseases are quite rare. But in the recent decades, single genome-wide association studies and candidate gene studies before that allowed us to identify new genes, so-called non-Mendelian penetrance, non-Mendelian inheritance, which are more common mutations, but have low penetrance. They comprise smaller risks than familiar or Mendelian autosomal dominant genes, inherited genes, but at the same time, the role of these genes should not be underestimated in development of intracerebral hemorrhage. And indeed, there are dozens of risk genes which contribute to development of intracerebral hemorrhage, as well as they also predict outcome of this really debilitating disease. We all know that intracerebral hemorrhage is one of the most serious type of stroke, and almost 50% of stroke mortality is attributed to intracerebral hemorrhage. In the recent studies, the new genes were discovered which are associated with deep hemorrhages. This is also important because deep hemorrhages, many decades, deep hemorrhages were thought not to be associated with any gene. And also, it's also important to have some scores, genomic risk scores, which implies the combination of different genes effects, and we can calculate the effect of different genes and sum up this effect and come up with genetic risk scores. And genetic risk scores is also very, using this kind of scores is really a promising avenue in terms of defining the risk of this intracerebral hemorrhage in particular person. And we also have to consider the burden of different genes which have mild effects individually, but when they are presenting together, the effect is rising, and the possibility of development of intracerebral hemorrhage is much higher when the different genes contribute cumulatively. So we have also to consider the cumulative effect of different genes.